Hello, and welcome to the Chest Journal's Editor Highlights podcast. Each month, Chest Editor-in-Chief Dr. Peter Mazzone highlights key articles from the current issue of the journal to help clinicians stay informed about new research in the fields of pulmonary, critical care, and sleep medicine. To introduce this month's episode, here is Dr. Peter Mazzone.
Thank you for tuning in to the Editor's Highlight podcast for the August 2025 issue of the journal Chest. We have a great lineup of diverse content in this month's issue. Over the next 15 minutes or so, I'll provide a brief overview of key manuscripts published in each of our content areas. We'll start with our asthma content area. Asthma exacerbation risk prediction is important in severe asthma management. In this issue, Yadav and colleagues developed a Bayesian network analysis using relevant predictors and categories that included demographics, lung function, inflammation biomarkers, healthcare utilization, medications, exacerbation history, and comorbidities. The network analysis was applied to 6,814 biologic-naive severe asthma patients from the Severe Asthma Registry. The study was designed to determine how the interplays of clinically relevant predictors lead to severe exacerbations in patients with severe asthma. They found that blood eosinophil count, fractional exhaled nitric oxide level, and the percent predicted FEV1 directly influenced the transition between prior and future exacerbations. Chronic rhinosinusitis indirectly affected the transition, and macrolide use independently affected the history of exacerbations. The model discrimination was moderate. These findings identify a prediction pathway of severe exacerbations and the influence of chronic rhinosinusitis and macrolide use. Next is our chest infections content area. There's limited data on patients with inflammatory bowel disease-related bronchiectasis. In this issue, Friend and colleagues report findings from a single-center retrospective study of patients visiting an inflammatory bowel disease unit at a tertiary center. The study was designed to identify the prevalence, risk factors, and clinical characteristics of inflammatory bowel disease-related bronchiectasis. 254 of 1,637 patients with IBD had a prior chest CT scan. 30, or 1.8% of the entire cohort, had bronchiectasis, with an estimated overall prevalence of inflammatory bowel disease-related bronchiectasis of 5.2%. Ulcerative colitis, prior IBD-related surgery, and the presence of extraintestinal manifestations of IBD were risk factors for IBD-related bronchiectasis. Despite symptoms, many patients did not see a pulmonologist nor receive bronchiectasis-related therapy. Clinical characteristics and outcomes were similar to patients with non-IBD-related bronchiectasis. These findings show a relatively high prevalence of IBD-related bronchiectasis and an opportunity for more timely referral and treatment. Our COPD content area is next. Menthol inhalation lowers dyspnea ratings during loaded breathing in people with COPD. In this issue, Schaefer and colleagues report findings from a trial of 20 people with COPD who completed 2 constant load cycle exercise tests to exhaustion, randomized to have menthol or placebo added to the breathing circuit. The study was designed to determine whether menthol inhalation is able to alleviate exertional dyspnea in COPD. Serial dyspnea intensity ratings were lower with menthol, as were ratings of dyspnea unpleasantness, air hunger, and mental breathing effort at end exercise. Menthol-related improvements were correlated with higher endurance time. There were no differences in ventilatory and neuromuscular parameters, 85% reported easier inspiratory airflow with menthol. These findings suggest that menthol inhalation may be useful for management of exertional dyspnea in selected people with COPD. Other original research in this section includes an evaluation of CT emphysema subtypes in cardiac hemodynamics estimated by MRI, a MESA COPD study, and a study that phenotypes exertional breathlessness using cardiopulmonary exercise testing in people with chronic airflow limitation. Completing this section is a How I Do It review on selecting an inhaled delivery system in COPD. Next is our critical care content area. There's limited evidence to support the routine use of continuous glucose monitoring in the ICU. In this issue, Frank and colleagues report findings from a single-center, investigator-initiated, parallel group, open-label randomized controlled trial of 85 adult patients admitted to a medical or surgical ICU who had diabetes or hyperglycemia and were treated with insulin. The study was designed to determine if continuous glucose monitoring in critically ill patients with hyperglycemia improves the time within a target glucose range. They found no statistically significant difference between continuous glucose monitoring and standard of care for the primary outcome. The only statistically significant difference noted was related to patient satisfaction. These results do not support continuous glucose monitoring as the superior method for routine glucose monitoring in the intensive care unit. Also in this section is a randomized trial of Normasol R versus lactated ringers in the critically ill, and a research letter on the epidemiology of ICU use in people with sickle cell disease in New York State. Completing this section is a special features article on vascular disturbances of the skin in critically ill patients. On to our diffuse lung disease content area. Quality of life is poorly correlated with conventional spirometric lung function in people with sarcoidosis. In this issue, Tumpanakis and colleagues evaluate quality of life and lung function in 62 patients with pulmonary sarcoidosis in order to determine the relationship of a quality of life measure with comprehensive lung function assessment using oscillometry. Oscillometric indices that describe peripheral lung dysfunction showed significant associations with the St. George's Respiratory Questionnaire score. The FVC percent predicted, RV to TLC ratio, and exhaled nitric oxide levels were at most weakly correlated to the St. George's Respiratory Questionnaire score. Measures of the elastic properties of the lung predicted an impaired quality of life even in those with normal spirometry patterns. Peripheral airway function parameters, NX5, formed independent clusters in hierarchical clustering. These findings indicate that parameters of peripheral airway dysfunction correlate more strongly to quality of life than spirometry measures in people with sarcoidosis. Also in this section is an evaluation of the relationship between changes in lung function and mortality risk in people with IPF, and a chest review on post-operative lung transplant considerations in the older recipient. Next is our education and clinical practice content area. Little is known about the impact of abortion bans on specialties other than obstetrics and gynecology. In this issue, Hauschild and colleagues report findings from semi-structured interviews with 29 pulmonary and critical care medicine physicians, analyzed with an abductive approach to determine how abortion bans have impacted the clinical practice, well-being, and careers of pulmonary critical care medicine physicians. The impacts that physicians describe for patients and physicians include restricted and delayed treatment, moral distress, and impacts to training. Variable and vague institutional guidance was provided for physicians. concerns about disparate impacts across social groups were commonly noted. Novel forms of harm mitigation and increased political activism were identified. These findings show that abortion bans are impacting patients and physicians in medical specialties outside of obstetrics and gynecology. Completing this section is a cohort study that evaluated spirometry abnormalities and immune dysfunction among adolescents with and without HIV in Kenya. Our pulmonary vascular content area is next. It is unclear whether main pulmonary artery enlargement offers additional prognostic value to validated risk scores. In this issue, Cao and colleagues report findings from a retrospective review of 351 people with pulmonary arterial hypertension, designed to determine if main pulmonary artery diameter is prognostic in pulmonary arterial hypertension, independent of existing risk scores. Main pulmonary artery diameter was a predictor of primary events that included the composite of death, lung transplant, and right-sided heart failure hospitalization. The hazard ratio was 1.06 per additional millimeter. Main pulmonary artery diameter remained an independent predictor after adjustment for 3 risk scores and their individual components. Main pulmonary artery growth rate also predicted the outcome, with a hazard ratio of 1.79 per millimeter per year, independent of baseline main pulmonary artery diameter. Using the main pulmonary artery diameter in addition to the REVEAL 2.0 score resulted in risk reclassification in 23% of patients. These findings indicate that the main pulmonary artery diameter is a significant independent predictor of adverse clinical events in people with pulmonary arterial hypertension. Also in this section are 2 additional original research studies. The first evaluating whether characteristic pulmonary impedance with exercise can detect abnormal pulmonary vascular response and uncoupling in pulmonary hypertension in individuals with heart failure with preserved ejection fraction. And the second was designed to determine whether echocardiographic parameters can enhance risk prediction scores in people with pulmonary arterial hypertension. Next is our sleep content area. Recent advances in artificial intelligence have enabled obstructive sleep apnea detection using breathing sound recordings. In this issue, Tan and colleagues report findings from a Bayesian bivariate meta-analysis and meta-regression of 16 studies that included 41 different models trained on 4,864 participants and tested on 2,370. The study was designed to assess the diagnostic accuracy of machine listening for obstructive sleep apnea. Machine listening achieved a pooled sensitivity of 90.3%, a specificity of 86.7%, a diagnostic odds ratio of 60.8, and positive and negative likelihood ratios of 6.78 and 0.113, respectively. Increased sensitivity was related to higher audio sampling frequencies, non-contact microphones, higher obstructive sleep apnea prevalence, and train test split model evaluation. Home smartphone versus in-lab recordings, deep versus traditional machine learning, and variations in age and sex did not influence the accuracy. These findings suggest that machine listening has an excellent diagnostic accuracy comparable to common home sleep tests. Next is our thoracic oncology content area. Robotic-assisted bronchoscopy is gaining adoption, but evidence of the outcomes in real-world settings is lacking. In this issue, Murgu and colleagues report findings from a multi-center, prospective, single-arm study that included 679 subjects from 21 sites. The study was designed to determine the clinical safety, navigational success, and diagnostic yield of robotic-assisted bronchoscopy for biopsy of peripheral pulmonary lesions 8 to 50 millimeters in diameter. The mean lesion size was 20.9 millimeters, with a median distance from the pleural surface of 5 millimeters. Complication rates were 3.8%. The lesion was reached in 98.7% of cases, and location was confirmed with radioprobe EBUS in 91.7%. The prevalence of malignancy in the study was 64.1%, and the diagnostic yield, based on strict reporting criteria, was 61.6%. The sensitivity for malignancy was 78.8%. These findings suggest that robotic-assisted bronchoscopy-guided sampling of peripheral pulmonary lesions is safe and has a diagnostic yield that compares favorably to non-robotic bronchoscopy reports. Also in this section is an original research article that evaluates the impact of clinically significant pleural effusions on survival of U.S. veterans with cancer, congestive heart failure, and pneumonia, and a research letter that reports on factors associated with no-show rates for lung cancer screening CT appointments. I encourage you to read our commentary series, where you will find 2 reports from our Statistical Techniques for Clinical Researchers series, and our Humanities series, where you will find an exhalations piece titled The Invitation to the Symphony. Finally, please review our case series publications for the month, which provide novel and educational cases to help improve your clinical skills. I hope that you enjoy reading all of the high-quality content available in this month's issue of Chest. As always, I'm grateful to the authors of this work, the reviewers who volunteered their time to improve the quality of these manuscripts, and to our editorial board for guiding everything that we do. Until next month, I hope that you enjoy the August issue.
Thanks for listening to the Chest Journal's Editor Highlights podcast. You can find the articles mentioned in this podcast and more on chestjournal.org. And if you're looking for more context and commentary on articles in the current issue, please check out the original Chest Journal podcast, which features in-depth discussions with the authors themselves. We'll be back again with more Editor's Highlights next month.